Hey guys, it's HINA here at Rebalance Physical Therapy in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And today I'm here to talk to some of you who may have been diagnosed with something called Osteitis Pubis, or perhaps you've kind of self-diagnosed yourself on Dr. Google. So I'm here to talk to you a little bit about what is Osteitis Pubis, what are the general symptoms that you might be feeling. Perhaps some of you may have already had treatment for it, but it hasn't worked. What are the different things that can be done about it? So first and foremost, what is osteitis pubis? So osteo simply means bone, itis means inflammation, and pubis means the pubic bone. So that's exactly what osteitis pubis is. It's inflammation of the pubic bone. So where is this when you look at a pelvis? So here is a model of the pelvis. In the front, you have the pubic bone right here, which you have one on each side, and they're attached together, and this is called the pubic symphysis, which is the pubic joint. Now, both of these bones can be pulled apart, okay? But they also attach in the back to this other bone called your sacrum. And some of you may have already heard of this. This is called your sacroiliac joint. And then up above, this is your spine. Okay, and if you turn this model to the side, right here, the circular area that you see is where the hip joint attaches. So you can see how intimately this pelvis has connections to the spine as well as to the hip. Now again, osteitis pubis is inflammation of this bone. Now, what are the symptoms of osteitis pubis? Now, typical symptoms that most people may feel is they have aching, throbbing in this area. They may have shooting sharp sensations in the pubic bone. They might also have clicking and maybe even some popping in this area. Usually it could be one-sided over the other, but I've had people that experience pain that changes from one side to the other, or that they feel pain there all the time. Now, typically what you will feel is that this, usually you'll feel any type of sports activities such as kicking, running, twisting tends to irritate it. But you could also have daily activities such as walking, twisting, turning in bed, getting out of bed, or even going up and down the stairs that tends to aggravate this area. And usually rest makes it feel better, as well as perhaps even taking some over-the-counter anti-inflammatories and things like that. So that's what you typically may be feeling. Sometimes it can go into the groin as well, but typically most people will feel that it's in this area of the pubic bone, and that could go into the groin. Now, why does this occur? Usually it can occur, again, due to everything from feeling something going on after any type of pelvic surgery, sometimes even abdominal surgery, or you can feel it in sports events, such as if you are an avid runner or an athlete doing twisting, kicking type activities. Maybe you've done more than, what you normally do, and you start feeling pain in this area. Again, usually pain is gradual. However, we have lots of people that are diagnosed with this that, just recently maybe had a baby or during pregnancy that they start to feel this, or they feel it postpartum, or for sometimes this is just another thing that develops due to low back issues or hip issues that someone has experienced. So again, there could be a whole host of reasons as to why this joint can become inflamed and you're diagnosed with osteitis pubis. But usually what most people do is they'll see, a traditional physical therapist, or they'll see a chiropractor, and many of you might improve. But there is a whole nother population out there where it might get better, and then you go back to trying to do your sports, or you go back to doing your normal activities, but then that pain starts to come back again. And usually when that starts to happen, many of you may have had some things that are missed in terms of holistically treating this. Now, usually in typical physical therapy, what I've seen is that sometimes people will, your physical therapist might do a little bit of soft tissue work in and around this area, or maybe ultrasound or e-stim or something like that. Again, many of you may have heard of these things, maybe some of you haven't, but they're called modalities, where they might go in and then they might do some local treatment to this area. And then they give you traditional stretching and strengthening exercises for either the low back, pelvis, or hip area. And again, some of you, it may have improved, and good for you guys that have improved. But chances are, if you're watching this video, you still have these issues going on. So what more can be done about this? And usually what I say is, this is where you really need to find the help of a physical therapist that fully understands how to treat the pelvis, spine, and the hip, and that does this on a daily basis, pretty much all day. And this is what we do here at Rebalance Physical Therapy. Now, why is this important? Well, it's important for a couple of different reasons. Orthopedics, usually when you see an orthopedic physical therapist, many of them will work on the outside structures of the pelvis and the hip and the lumbar spine. Some of them might not even go as far as doing all of that, but usually a good orthopedic physical therapist can treat a lot of these things. However, there are muscles on the inside of the pelvis, which is called the pelvic floor. Okay, you can see it from the inside of the pelvis here, and if you turn it underneath, you can see that there are muscles that attach from the pubic bone underneath as well as to the tailbone down and through here. And again, these are your pelvic floor muscles. These could also be involved in addition to all the other muscles on the outside of the pelvis, the hip, and the spine that may not have been addressed completely and holistically. And if you have any type of imbalance, okay, in and around this pelvis or spine, or even higher up into the head and the neck, or even all the way down into the foot and ankle, then this could be compensating, and you might be overusing this musculature when you're doing, again, any of your sports, or if you are doing your daily activities such as walking, gardening, doing any of those things that you love to do. So now let me give you some examples. Now, say if somebody you've developed this osteitis pubis, but this is secondary to something else that has been going on. So say I am someone who has been having head and neck and maybe upper back and shoulder issues for some time. Now, because of whatever might be going on, I may be holding my body in a right twisted fashion, meaning I tend to hold, and again, I'm exaggerating this so you guys can see this on camera, but say I am twisted to the right. Now there's two ways. You obviously have to continue to, see forward, okay? So if I'm twisted to the right, I have to turn my head and neck to the left in order to see straight and to function in my normal everyday life. But if I decide, hey, I don't want to twist my head to the left, then what I might do is twist my lower body, which is going to take the pelvis over to the left. And what that will do is it will change how the muscles on one side of the body function from the other side of the body. And that can create imbalances in the musculature, which now put abnormal stress on the pubic symphysis joint. So that's an example of something away outside of the pelvis that might be creating issues here. And those things might need to be addressed in order to help decrease the irritation and stress to the pubic bone. However, some people have other issues that are happening directly inside the pelvic floor, or imbalances directly that are happening in and around the pelvis. And so what can happen here is that oftentimes this bone ends up getting lax because of also laxity in the joint back here. Laxity meaning that the ligaments that attach one bone to the other, okay, that's what ligaments do, they attach one bone to the other. These ligaments can become lax either due to perhaps a fall in the past, perhaps due to another injury, perhaps to somebody who has had another diagnosis called a sacroiliac joint issue, or maybe even into a low back issue that ends up creating increased motion in this joint, which then translates to abnormal movement in this joint. And again, that creates more stress, inflammation, and again, that could be the cause of something more directly related in and around the pelvis. Now, we see this all the time also where people have had issues on the inside of this muscle. So they get imbalances in the pelvic floor musculature, which again, you can see these muscles attach again to the pubic bone, as well as to the other bones that are part of the pelvis. And if these muscles are too tight or too weak or a combination, that can change it can change the alignment of these bones, because now you have, say you have too much tightness here in these muscles, that could be pulling and tugging on one side. Say you have weakness on the other side, that could be creating less stability in these in these joints, sorry. And then you might have other muscles that are connected from the abdominals to the glute muscles, which attach here, to other hip muscles here that are also in imbalance. And that might be causing, again, asymmetry from one side to the other in how this joint is stable and working. And that could be causing the issue as well. And so everything from doing hands-on therapy to improve the balance and symmetry of how these muscles are working, to a whole host of other things that create stability in the pelvis, and to also address the symmetry of the spine and the hip joint, as well as working internally on these pelvic floor muscles, might be something that needs to be done to help calm down the issues that you're feeling at the pubic bone. So I know that's a mouthful and it's a lot to kind of comprehend, but I know, because we see this every day in our practice, so many people coming in with these issues, and that's why I wanted to do a video for all of you who are perhaps continuing to experience these symptoms and you feel like you've done everything you can and you're not sure where else to turn, or perhaps, you know, there's nothing more that your physicians are telling you can do except go back to more therapy. Well, you've already done that. So what you really need to do is find someone that fully understands how to comprehensively treat this in a holistic way that also does a lot of hands-on treatment, which is what we do here at our clinic. So if you live in and around the Philadelphia area, and like I said, we have lots of people that come in through out of town. However, if you need to stay local to your community, then you really do want to find someone that specializes in orthopedics as well as pelvic floor dysfunction, that truly understands how to treat this outside as well as inside, because remember, those pelvic floor muscles are on the inside. If you can't find someone in your area, I encourage you to come send us an email through our website. Our website is rebalancept.com. That's REBALANCEPT.com. And you can, let us know where you live. And then we can send you perhaps some people that we know, or links to, who you might be able to find in your area. Again, you'll probably need to call them and make sure that they know how to work on these things. Or again, if you live in this area, then it's a no-brainer. Come in and have an evaluation with us, and we'll be looking at you from head to toe to see how these things might be interconnected, what has worked and what hasn't worked, and what more we could do for you. Now, we also have lots of other videos through our YouTube channel, which can be accessed through our website, that also talks more in depth about pelvic floor dysfunction and other hip dysfunctions that might also give you a more holistic understanding as far as other things, especially for some of you who not only have osteitis pubis, but you might have other things going on like low back pain, abdominal pain, pain with intercourse, all those other things, and how all these can be interconnected together. So again, come visit our website, REBALANCEPT.com. And I hope this video was helpful to some of you and you find the right care. Have a great and wonderful day. Thanks.